Hello everyone, myself Dr. Rakshita. I am currently working as consultant gynecologist and IVF specialist at Indira IVF Hisar. And today we are going to talk about myths associated with miscarriages. So before that, I would request every one of you to follow all the precautions to fight against COVID virus, and please maintain social distance. Please don't go out of your houses if there is no urgent work. Please wear masks. Please maintain social distancing, and please maintain hand hygiene. These are the only steps that have been seen to be effective against this virus, and go ahead and get vaccinated and keep yourselves and your family safe. So moving on, today's topic is myths that are associated with miscarriages and why are so many people concerned and have fears about having a miscarriage after IVF. So when we talk about miscarriage, what is it? It's abortion, like everybody say in normal terminology says that it's a termination of pregnancy that happens anytime during the pregnancy. But we doctors tend to divide this into two parts: the first 3 months of the pregnancy and the second 3 months of the pregnancy. So, first 3 months of the pregnancy, the miscarriages that happen in that part are usually associated with some problems in the endometrium, in the uterus, or in the embryo. And the second half, that is in the third, fourth, fifth month of the pregnancy, the miscarriages happening in this half are usually associated with some abnormalities in the uterus, like septate uterus, arcuate uterus, biconvate uterus, cervical incompetence. That means the cervix is very dilated, or it doesn't provide that strength or that support to the pregnancy, or any other disorder that leads to some abnormality in the uterus, like fibroids or any myometrial cysts. So these are all the reasons that can be seen associated with the miscarriages in the second half of the pregnancy. So the myths that are associated with miscarriages are: the most common myth is that when you undergo IVF, you are more prone to miscarriage. So that is very wrong to think that you are more prone to miscarriages, because in IVF, the reasons that are associated with the embryo are usually dealt with even before the embryo transfer is done. That means the abnormalities of the embryo are seen to be less in cases of IVF because of PGS, pregenital testing that the embryo is going through, because of the best selection of the egg, of the sperm, and the best selection of the embryo. The chances of embryo being abnormal is way less, and that is why the chances of recurrent pregnancy loss or miscarriages in the first 3 months of the pregnancy is less after IVF than after natural pregnancy. Also, a myth that is associated with miscarriages is that after IVF, you need to take complete bed rest, or otherwise you will have a miscarriage. So I would like to tell you that when you move around, when you are active, when you are doing exercises, what is happening is the blood circulation from your legs is going into the body. The blood circulation is very good. That means the uterus is also receiving a good blood circulation when you are active. So that good blood circulation helps provide better blood circulation to the uterus, to the pregnancy, and that means your pregnancy tends to be better, way healthier if you are active. And that is why we at Indira IVF advise our patients not to take complete bed rest until and unless it is advised because of some special circumstance. And we request you to at least walk around for 1 kilometer so that you are active. So that is why I would request my patients to be more active and to avoid complete bed rest until and unless we have requested them, we have asked them specifically, and enjoy their pregnancy without any fear of miscarriage. The other myth that is associated with miscarriages is you need to have a specific type of diet, you need to have a specific kind of food in your diet, and only then can you be sure that your pregnancy will be fine. People ask me about the consumption of nuts, of non-vegetarian food, of eggs, of or any food that they think that it is very heavy. The thing that I tell everyone is, when you have food during pregnancy, first thing, it should be healthy and well balanced diet. That means the food should be very high in vitamins, in minerals. It should be well balanced. Your requirement of carbohydrates, proteins, and fats should be fulfilled by the diet that you are taking. Second thing you need to keep in mind is that the diet should be good, it should be healthy, it should be bacteria free. That is why we ask our patients not to have food outside or to avoid junk food, because we know that it might not be that healthy, it might not be that hygienic, and that is why we urge you to take food which is home cooked. Third thing that you need to keep in mind is, when you are having your food, you need to weigh which food is associated with which type of vitamins or which type of minerals, and whether those are contraindicated or not advised to be taken during pregnancy. Like we ask our patients not to take papaya or pineapple, unripe papaya and unripe pineapple, because some certain types of enzymes are found in these fruits which increase the chances of miscarriages. So go ahead, ask your doctor what all food items need to be avoided during pregnancy, and rest all you can have as much as you want and enjoy it. So the other myth that is associated with miscarriages is only female factors. That means reason behind miscarriage can only be in a female. So when people come to me, they usually are the patients who cannot conceive even after trying for 1 year. That means infertility patients are coming to me. But many patients are coming who have history of conceiving naturally and losing their pregnancies early, like cases of recurrent pregnancy losses, or many cases who have even tried other methods of conception like IUI or IVF and have faced recurrent implantation failures. So when these people come to me, I tell them that the problem can be in the female as well as in the male, and we need to find out the reasons behind it. So, this is a myth that the problem can only be in a female partner, because we have seen cases of severe OATs or very raised DFI or where many other problems of semen that are causing the problems in the embryos and leading to miscarriages or abortions in the early phase of the pregnancy. So, we need to find out the exact cause, and that cause has to be found out both in the female as well as the male, so that we can deal with it. So these were certain myths that were associated with miscarriages, and certain myths that were associated with miscarriages after IVF. And as I told you earlier also, in case of IVF, since we are testing the embryos, since we are selecting good eggs and sperms, we are dealing with the problems of uterus way ahead before embryo transfer. That is where the chances of miscarriage after undergoing IVF are way less than after natural conception. Still, if you are facing the problems, and you have faced such problems while undergoing treatment earlier, you have undergone treatment somewhere, or you have been conceiving naturally, and you are still facing this problem, you can contact us or visit us and meet our experts, and we will try to answer all your questions and try to solve all the problems that you are facing.